Good afternoon. I'd like to share some updates related to our public health response and describe some of the issues that we're working on in partnership with our healthcare partners during this very challenging time. First, wanted to correct something that I mentioned in yesterday's briefing that was inaccurate. I'd said that we had about 10% of individuals tested positive for COVID-19 that were hospitalized. In reality, we believe that number is higher, probably as high as 20%. And the reason for that discrepancy is that the way that we collect information about positive cases comes directly from reference labs rather than hospitals themselves. So we've learned that in a lot of cases, the information about whether a patient is hospitalized at any given moment is missing. So it's one of the things that we're really working hard to do is to develop new, better, and innovative strategies to look at a large number of data sources so we can keep very close track on the critical health system resources and understand exactly who is hospitalized and who's requiring critical care. There are two important things that we've learned from research about the virus that I think need to be underscored to really talk about why this is such a grave situation. The first is the very high proportion of individuals who contract the virus who will have mild symptoms. So that's good news and bad news in the following sense. We've learned from other countries that as many of 90% of people who have the infection don't require symptoms that require medical care. And so since we've generally test people in the setting of a medical evaluation because they have symptoms, that could mean that for every individual that we test that tests positive for the infection, there are 10 individuals in the community with mild symptoms that don't seek care. So we're having a small number, hundreds of cases in the state, but it would potentially be thousands right now. And there's potential that people will develop increasing or worsening symptoms in the future. That's another thing that we've learned about the virus, is that sometimes initial mild cases can become more severe. The second thing we've learned about the virus is that it's very highly transmissible, even from people who have mild symptoms. When we've studied the data from the other countries in terms of the speed and the size of the outbreak, we've learned some of these important parameters about this epidemic. The first is the reproductive number, or how much we expect, how many additional cases we expect to become infected for every one case. That number is between 2 and 3, which means that for every person we might have 2 to 3 more people infected. Other parameters around that we talk about are in terms of the doubling time. How long does it take for the number of people who are currently infected to exceed it by a factor of 2? And that number in other countries has been around 6. But we've seen in this country and other settings that the number of cases reported in some states has doubled in as few as 2 to 3 days. So we're very concerned, as the Secretary mentioned with some of these modeling, that this could develop much larger very quickly, and that's really why that's really the justification for the measures that we're talking about. So the science is pretty clear that the measures we're taking for the entire state in terms of limiting our physical contact is really the main tool that we have to address the crisis, and if we do so well, we can save many, many lives. The last thing I really wanted to echo that we're addressing and really focusing on in public health is that these social distancing measures that we're recommending are themselves not without risk. So to use a medical analogy, many times the treatments that we prescribe for disease have a risk of side effects. In cancer care, we can cure very aggressive tumors, but the treatments that we required sometimes make people feel quite awful and can be very toxic. So the intervention that we're recommending for this pandemic recommends isolation, social distancing. Social isolation can be very toxic for people. It can make people feel awful. So we really want to draw increasing attention to the idea that while we need to have physical distance between people, we want to do everything we can to stay socially connected, and the resources that the Secretary mentioned are great examples of this. In healthcare, we're also really focusing on using innovative tools in telehealth and telephone-based interventions to make sure that people feel connected to their source of medical care, particularly in mental health care. Finally, I just wanted to echo the sentiment that the Governor and the Secretary mentioned and just to express our profound gratitude in those of us working in medicine and public health. I acknowledge it's difficult to really conceptualize and see what a historic threat this is when we have such small number of cases, but that we've learned enough about the virus and we've observed enough about the epidemic in other countries to know that this is truly a grave situation, and all of the things that we're recommending we understand are not easy. And if we do them well, they're going to seem like tremendous overreactions, because that's going to mean that the virus, the epidemic did not get too far out of control and become too large. But that's really our goal, and we really appreciate the support of everyone as we get through this together.